Good afternoon, Miss.
Sorry for the delay because we had an orientation program for the second batch, right? So that's why I got some delay. Okay, without further delaying, I'll share my screen. Can you all see my screen?
Yes, Miss.
Yes, ma'am.
Okay. In today's session, we are going to specifically seeing about the person-centered care. But you all have an idea regarding the person-centered care before because we already studied regarding what is this person or the client or the patient-centered care. But mostly, I would like to say that don't address the people like a patient. Okay, it's better to address by the word client. So we can tell it as a person-centered care or client-centered care or the individual-centered care. So today's session we are going to see so what is this person-centered care means and what is the meaning of person-centered assessment. And the important thing of today's session is how this person-centered assessment or the person-centered care can make the individual to include or to be inclusive in the assessment process. So if we have the person-centered assessment, if we have the person-centered care, then how it will be helpful for the each and every individual to engage in their assessment process. So those are the things that we are going to see in today's session. So we'll see one by one. First, we'll see the person-centered care. You all know what is the person-centered care means. So normally in the health and social care, in the healthcare sector, we are focusing on the person-centered care because we know that not all the individual are same. Each and everyone are having uniqueness. So as a healthcare professionals, we need to accept their uniqueness and we need to provide the respect, dignity, and the care that we are going to plan all should be according to that uniqueness, right? So for an example, if for an example, two person are having a fever, two persons are having dengue fever, and the management for the two persons could not be same. Why? Because one person, the uniqueness could be there, right? So one person may have some very lean body and they can't tolerate some kind of foods or they can't allergics to the medication. So likewise, you need to assess the patients completely before starting any care management. You need to assess the patient completely, and for that only we are having and we studied regarding what are the guidelines that we can use to gather the informations, right? So for the person-centered care means like that. So we need to accept the accept the person's ideas and their suggestions when we are developing when we are making any decisions for the care management of a particular individual, we need to include them. So if the person likes to involve their family members, yes, we need to accept that one and we need to involve them. And the care program should be developed according to the patient's preferences. If the patient having any desires and if they have any different kinds of preferences, we need to include all the things and the care should be developed according to that. So that is we are telling it as a person-centered care. And if the care that you are going to provide as a healthcare professional is a person-centered only, the quality of life of each and every individual could be developed. Why? Other than that, we can't have a good impact on the, or we can't gain or we can't achieve our goal, what we have planned for. So the person-centered care means respecting and responding to the needs and preferences of an individual. So another word, in addition to respecting, you need to respond, right? So whatever the person is asking, whether it can be a physical needs or the psychological needs or the emotional needs, whatever the needs or whatever the client is asking or seeking from you, you need to respond it. You can't neglect any of their desires or need. Okay, then it won't be a good care profession, right? So once you become a good care care provider, so you need to be respectable, you need to respect their desires, and at the same time you need to respond to their desires. Sometimes the questions or the needs that are asked by the client is not a practicable one, right? So in that situations, as a healthcare provider, you need to explain them, you need to provide much more information, and you need to explain them what are the current situations are prevailing and what are the body conditions. Because for example, sometimes for example, a person admitted for the cancer treatment, and he or she may having only 1 month of the survival rate. Okay, within 1 month he is going to die. So in that period, she may ask. So it is actually, as even as an individual, we also won't accept the death if it occurs. If we know our date, it is a crucial one to live a life like that, right? Because we are counting our days each and every day. So in that situation, so if the person is sometimes the person may ask. So in that situation, the person is very much attached to all the people because they know that they are going to die within 1 month. So in that they need to pamper them by all the people. Even they ask to pamper the healthcare professionals as well. So they becomes like a child. Why all these things are happening? Because they starts to afraid of their death. So that is the actual thing happening. So in that situations, so it is not actually possible to spend all the time as a healthcare professionals only to her or him, right? Because when we take a nursing officer or any other healthcare professionals, they need to look after all the people, all the clients in a particular ward setups, because they are providing services to all the people. So in that manner, sometimes the need of the particular cancer patients could be neglected if it is not an important one. Like if the cancer patient asks the nursing officer to come and sit besides her, or come and sit next to her and always talking with only him or her, it is actually not possible one. But so in that situation, we are in a stage of needs to neglect that responding. So in that manner, okay, we can do, but you can't neglect all the immediate needs of the client. Immediate needs means uh, actually is sometimes the person may needs to control the, if the bleeding is increased, if the blood loss is increased, yeah, then you need to go and look after that bleeding, and you need to stop the bleeding whatever the way. Okay, so that is important. So that is you are telling it as responding. Or sometimes as a psychological supports, some long term hospitalized clients, they may ask their family members to look after them, right? Because normally we are some in some ward setup, we are not allowing the family members to stay along with them. In that situation, they may expect those things. If it is possible and according to the patient situations, if the need is very important one, you need to respond all the things. So patient or the sorry or the person or the client centered care is that. So you need to respect the perspectives. At the same time, you need to respond to the desires and the perspectives of a particular individual that you are going to care. And also you need to empower them to make decisions that best fit their individual needs to improve the quality of care. And the another one is, so as a healthcare providers, you need to improve the confidence on each and every individual that they can make a better decisions about their care program. That means it's a kind of improving an independency on each and every individual who are receiving a care from you. So throughout your care, as I already told you, throughout your care, you can provide a kind of dependency to some period of extent. So about that, you can't, it is not actually possible to extend that dependency throughout the lifetime of each and every individual, because once the healing period or once the person become okay, however, he needs to or she needs to leave that particular ward or the hospital. Okay, or as a home caregivers, you need to be left them. You need to be leave them once once your care providing period is over. Okay, you can't travel for the whole life, right? So in that situation, so with if you are having your care period within 1 month, 2 months, or 3 months, up to what level you are having within that period, you need to train your person or the client, that you need to make them to think confident that they can do anything, even they can make a decisions on their own for their care management as well. So whatever they need, they can. You need to develop a kind of confidence to express all the needs and the desires to them. And also, if you are not like to do the treatment, then you can develop a kind of confidence to refuse them, right? So while if you are not having, if an individual is not having that kind of confidence to refuse them, then the healthcare professionals, they can think that they can do whatever they want, right? So actually, because the basic concept or the basic right of each and every client or the individual is, they have the right to refuse the treatment if they are thinking that it is not appropriate their situation, or if it is not appropriate their body conditions, then they can refuse them, right? But if they are not try to refuse, because sometimes they may think if they start to refuse, then the treatment provided by the doctor or the nurses would not be good, they won't consider them. So like the thoughts they may start to develop. In that sense only, they will accept whatever the things that are saying by the doctor or the nurse. So it is not actually good, because so accepting the doctors, advisors, and the nurses as advisors are okay, but it will not good, or it will not be okay in all the situations. Sometimes there could be an harassment or the abusive instances also will be developed if a person is not a, courageous person, or if the person is not having any confidence to refuse the doctor or the nurses, because they are thinking the nurses and doctors, they are knowing all the thing and they are superior than me. So these kind of thoughts they will start to develop once they going to receive the care. But if you are going to be an effective caregiver, you need to develop like confidence, and you need to empower your individuals to take all the decisions that they need to own, and to remove the dependency on the care providers. So through your care, you need to develop all the things on your person as well. So that is the actual meaning of the person-centered care. Not only providing the physical comfort to the client, you also need to enhance the quality of life. Quality of life means it is not only referring to the physical life. It is also involving the social lives, emotional lives, these attitudes, behaviors, courageousness, all will be included in the quality of life. So person-centered care. So this is a kind one definitions that we can use to define the term person-centered care. Then we'll see what are the objectives or the goals of this person-centered care. So why what this person-centered care will provide to it, the client, or it can what it going to provide to the person. First one is promote client participation. Yes. So the most important use or the most important aim or goal will be, it includes the client participations, right? So when you are talking about, when you are including your patient or the client in your care program only, it will be effective, because you don't know about the client actually. You will be only develop all your plan what the client tells to you. But once you develop a partnerships, like we yesterday studied the importance of partnership working with the client. So this promote client participation means it's a kind of partnership working with the client. So once you develop a partnership work only, you can get more and more informations from your client. Then only, that means you even sometimes if your partnership working is very, very good, and if you are a good partner to your client, they starts to reveal all their private and the confidential information as well, because some confidential informations will be helpful for developing or to create our care program strategy. So in that manner, the major one perspective or the major one goal of the person-centered care is promote client participation. Then build staff confidence. Yes. So if we have a person-centered care, then the professionalism also will be developed. When we talk about the healthcare professional sides, they will be very, very confident in their works. They become very skillful and they can take any activities with a confidence and they start to do. Why? Because person-centered care means you can't apply a one proposed care to all the patients, right? So each and everyone having different problems, and each and everyone having different thoughts. So you are going to face a diverse attitudes, behaviors, and even the physical problems also differ. So in that manner, once you approach each and every individual, you can have different experiences, like what the patient is going through and how the patient approaches you. So if the patient's approaching is not good, that is one sign that you are not a good caregiver. You are having some kind of problems on you. Then it will be helpful for the profession as a professionals to develop the quality, right? And also, if you start to work individually, then you can have a kind of confidence that you can handle anything without any fear. And also, you no need to depend on other healthcare professionals' order. You can take all the decisions on by your own, but you are accountable for this. Whatever the decisions you are taking, you are the accountable person, but you may develop some kind of confidence and courage to take all kind of decisions without any other physician's order, which are good for the health persons or the individuals. So normally when we talk about the Sri Lankan setup, we as a nursing officers, we needs to wait. I'm telling the normal ward setups, like we are having medical wards, surgical wards. The normal ward setups, actually, we are expecting some kind of approvals from the doctors or the consultants. Okay, if we are going to prescribe any tablets, new tablets, then we need to have a consultations from them. But in Sri Lankan setups, when we take the ICU, that is intensive care unit, like a special units, there is no any, and especially the emergency units, like we are having emergency unit and all those things. So in those unit setups, there is no any consultations. That means each and every individual having a courage. Actually, the persons who are working, the nursing officers who are involved in those kind of units are highly trained and highly skillful and courageable person, because they know that whatever the decisions that they are taking, they are the accountable one, but still they start to take all the decisions for the patient's sake, because emergency unit means normally if there is any emergency situations, like think about the situation accidents. If the person is got met with an accident and he is suffering for to live, then immediately we are transferring that particular person to a emergency unit in the hospital. Once we stabilize the patient's condition only, we are moving to the normal ward, right? So in the emergency situations, if we are receiving the person in like that situations, we can't wait to get approvals from the higher persons like consultant or doctors, because until that the person life may end up. Now the person's life in danger. So the each and every healthcare professionals, the nurses, normally in the EU, we are having nurses and the doctors. So the nurses and doctors, if the consultant is not available, okay. So they need to make a decisions immediately to make the patients make the particular persons a survivor. That means we need to prevent that persons from dying. Okay, so here we are not expecting anything from the consultant, and even the doctors also can't complain that she did everything by her own. So she didn't ask any questions from me. Likewise, they also can't do. Right. So when we talk about the emergency unit, there is no any power imbalances like doctors, consultants, right? So each and everyone are delegate with every duty, specific duties every day, and they are working as a team, as a collaborative team accordingly. So in that manner, so we can develop we can build a staff confidence. So it is also one example that the staff, they can build and confidence, because when we talk about those units, if a nursing officer is going to take any decisions without any consultations, if anything happens bad to that person, so she or he is the accountable one. So they all starts to blame on her. Although she knows everything, she had some courage to take decisions because for the sake of the person, right? So that is, we are telling that the healthcare professionals working are not the task oriented, because they are loving their profession and they are only working on for the sake of the person, right? And reflect the best practice. Yes, it is also coming for the professionalism. That means whatever the skills and knowledge they are having, so once they start, when we are having the person centered approach, they can express all their, or they can put all their knowledge and skills to develop an efficient plan. That means they can put all the things in the routine practical setups, right? So it is also, we can then, so it will be helpful to identify what capabilities and what abilities that each and every professionals are having in that sense, because we does when we are appointing, we don't know what the each and every healthcare professionals are best. So if we develop, or if we have this kind of approaches, then it will be helpful for ourselves also to identify what are the abilities I'm having within myself, right? The next one is promote a consistent approach to the adoption and implementation of values. Yes, so there are a lot of values, guidelines, all that there. So when we starts to work in a client-centered manner, then automatically we needs to promote all the approaches. So we need to promote a consistent approach in order to practice, and in order to implement all the values. And when we are working also, we need to respect all the values and all the activities of the each and every individual. And promote continuous improvement. Yes, with the person centered approach, we can promote the continuous improvement as a staff, as well as the care improvement also, the care that we are going to provide to the person also, we can going to change. It's a kind of dynamic, right? It is not a that means it is not a constant one. It is a flexible and a dynamic one, because patients, when the clients are changing, when the problems are changing, we are also having different skills and practices, and with that we are going to improve ourselves as well. And describe the appropriate patient-centered approach. Yes, so we can describe that. That means we can have a kind of detailed understanding what is this appropriate person-centered approach means, how we are going to implement the appropriate person-centered approach. So these are the major goals or the objectives of having the person-centered approach or the person-centered care. Are you all clear up to now?
Yes, ma'am. It's clear.
Okay. Now, next we'll move to the principles. So, what are the principles of this person-centered care, right? So, person-centered principles, the first, yes, you all know, individual at the center. The major concern of the person-centered principle is individual. They should be at the center. And inclusive and accessible, yes, the care that you are providing, you need to include all the health, the person, that the client And if the client accepts, then the family members or the care providers, so you need to include in your care program. And the care programs and the services that are available, it should be accessible to the client at any time. Whenever they need, it should be an accessible one. That means, so if it is available at any time, we are defining the term accessible. Accessible means it should be available at any time. Whenever the patient or the client needs, it should be available. And focus on outcomes. Yes, you need to be focused on your objectives. That means your goals, right? And inclusion of other means other healthcare professionals, or it could be a family members. Personal priorities and strategies. Yes, we need to give the prominent importance to the personal perspectives. And the commitment shared commitment means, as we already studied, partnership working. So the person centered care approach is a partnership working. So both the parties who are involving, they should be worked under some commitments, like, so they are providing whatever the care they are needing, and that is a kind of commitments we are having, right? So we are committed to provide all the care, and we are committed to fulfill all the needs of each and every individual we are having. So shared commitment should be there, right? And respects the culture. Yes, both the people need to respect the culture. When we talk about the clients, they also need to respect the culture of the healthcare professionals. They can't make any joking on the healthcare professionals culture, right? At the same time, the healthcare professionals also cannot be imposed their cultural views and perspectives onto the patient side. So they, both the sides, they need to respect their culture. And continuous process. Yes, it is continuously changing, right? It won't stop at any moment, because continuously we are having patients, because there is no any day or no any time without single patients, right? Each and everyone are having any problems, physical problems, mental problems, whatever the problems, and they are each and every day and each and every time they are seeking another one's care, right? So if it is a case, this person-centered approach won't be stopped. Once there is no any person, for example, if all the individual in the world become fully healthy, without any mental problem and without any physical, social or spiritual problems, if they are, if we have that kind of society or the world only, this process will be stopped. Until that, we needs to follow this process, but actually it is not the we can't have that kind of world, right? Because however, even we will have a very minute amount of problem in our everyday life. We will have physical problems or some kind of a short-term depression or short-term anxiety. So whatever, we are having a problems around us, right? So we can't lead a problem-free life is not actually happen. We can't expect, actually we can't expect the problem-free world in now, in a current situations, right? So in that manner, this person-centered approach also going to happen continuously. Regular review and continuous improvement. Yes, you need to review your yourself, right? So how you are providing the care, or you can have a peer evaluation also. Review means the evaluation. So you can have a peer evaluations, or you can have an evaluations by asking from your client. So how they are how you are providing the care, and how you are whether you are good all the activities, whether they satisfied with your care. So it's those are some kind of evaluations you can take on yourself. So it is important for having a continuous and regular reviewing and the improvement. Continuous improvement is important. That means you need to be changed according to the changing world. You need to be updated, right? So for example, I completed my bachelor's last year, 2021. So within my period of undergraduate, I experienced lot of clinical experience, different people, and also the theories that I studied, it differs within 1 year period. Like, so last year not last year, for example, when during my up to my fourth year, yeah, fourth year, no, up to my third year, where during the clinical setups, I'm telling one example. We are having one medications called augmentin, right? So augmentin we are having. You all may seen that sometimes we are giving the medications through saline. That we are telling that we are giving saline to the person because she or he can't eat or whatever. So likewise, like a saline, we are going to insert some liquid drugs or the medications to the patient's body. So up to my third year period, we used water. Normally, the all the medications will be comes in a small bottle in a powdered form. So we need to insert a water. We are having a separate water for that, or we can instill the saline, and we are dissolving that, and the medication will be drawn from the bottle and we are injecting to the patient. So up to my third year, we studied, we need to dissolve that powder for that particular medications in 10 milliliter of water. So we are having different kinds of syringes, 5 milliliter, 10 milliliter. So 10 milliliter syringe. But once soon after, so it happens third year, I think June, I think, but within 2 months, then so we finished our clinical posting from 2019 June, but I think 2019 October, November something, when we are posted for my next semester again, the dissolving method changed, right? In the hospital setups, they all starts to dissolve in the 20 milliliter syringe, right? So they starts to change all the things, but we doesn't know. So until that day, that means until my the second posting, we were not only myself, even our whole batch, we doesn't know that they have changed to dissolve the particular medication in a 20 milliliter, which was previously mixed with the 10 milliliter. So why I am saying it's a kind of continuous update, right? So you need to be updated. We are not updated. So if we were not appointed again, then actually we doesn't know that still they are we doesn't know that they have changed their practice, right? So we need to update, and especially when you are working in a health and social care sectors, you need to have updated knowledge, because due to the technological innovations, each and every day they are finding new things, and they are changing the principles and everything, guidelines according to the patient safety and the professional safety. They are changing, right? So you need to be updated, and with that update knowledge, you need to improve yourself. You need to improve your knowledge, your skills and practice. So once you update it only, all as a whole person, you will be improved. So this person centered principle also, one, it is also important to regular review and continuous improvements, and one person one plan. Yes, so it is another basic concept of this person centered principle. So there are major two basic concepts are there when we talk about the person centered approach. One is individual, or the person is at the center or the main concern. Other one is one person, one plan. That means for one particular person, you are going to plan a particular care which is suit to that particular person. Okay, so these are the principles that will going to guide you when you are going to approach, or when you are going to use a person centered approach, right? So are you clear up to now?
Yes, ma'am, it's clear.
Okay. So these are the major four values we need to respect when we are focusing on the person-centered care. So one value is build relationship. Yes. So once you are going to work as a, that means build relationship means your partnership should be very strong. You need to develop a good rapport and a good therapeutic relationship with you. So otherwise you can't achieve your goal. right? So once you started to work in a healthcare sector, it is important. And normally we also encounter so many cases in the hospital setups when we are work. That means now I'm not working as a nursing officer, but during my student period, when we are posted for the ward setup, one day I saw one patient. He's asking for one nurse to take the blood from him, right? So he refusing. If another, so I couldn't remember the nursing officer name. So that patient waiting until the particular nursing officer arrives to take the blood. So he is not accepting any other nurses to take the blood from them. So after, I think they asked to send the blood immediately for some referral. So then I think she also busy with another work. Then they called her. Then she came, and once after she came only, he accepted to provide the blood sample. Then she took the blood sample and sent to the laboratory immediately. So soon after that, so myself and my two friends, we went and we talked with that person, and we asked why you didn't allow other nurses to take the blood, because he told that others are not taking the blood in proper manner, because when they are taking, he feels severe pain, but when she is taking, it doesn't feel any pain. So that's why she is expecting only her to take the blood sample. So it is a kind of thought that develops. Actually, not like only her. Normally, when we are taking bloods, it will give pain, but the way that she approached the patient, right? Because more sometimes with the workload, we were not consider the patient, we were not talking, we are just going and putting all the tourniquet and all the things, and we are just drawing the blood and going. We are not asking anything from the patient, but the approach that she had, when the way that she approached each and every person or the individual in the ward setup is little bit different. So she impressed with her approach, that then that's why the person is or the individual always asking her to take the blood, right? So it is important when we are talking the person centered way. If your person centered care is an effective one, that means person centered care means the care that you are providing to the individual, if it is a effective one, it could be measurable how the patient is approaching you and how the patient develops a thought about yourself. So for that, you need to have a good rapport with the patient, good communication, and you need to follow a good attitudes and behavior about towards the patient. Then only you can develop a good, or you can build a good relationship with your patients, right? So it is one value. It is important. Values means the importance you need to give once you follow anything. Then be respectful. Yes. So although they are receiving a care from you, you can't disrespect them, right? Although they are needing you, you can't disrespect them, because one time there are chances you also becoming a care receiver and other persons will be a care provider. If the instance, if you also become a disrespect manner, if they treated you in a disrespectful manner, then you will feel how it was, right? So make sure that we also one day, there is a chances we also become a patient or the client, or we also need another person's care in that manner. So you make sure all the things, and once you are working, you need to respect whatever the background, whether whether she is a transgender, male or female, or whether the person is a rich or poor person, educated or not, whatever the things. So you need to keep all the things aside and think, yes, he is a living being. That means living human beings. He or she also having all the rights like us. So we need to respect them. So be respectable one and be accountable, right? So especially in the health, not in healthcare, normally in all the workplace, we are, each and everyone is accountable. That means responsible one. So in that manner, when we talk about the healthcare sectors, we are more accountable, more responsible. Why? You all know the work that we are dealing, it's a little bit different when compared to the other normal workplace. One mistake can make a life to be in danger. So in that manner, you need to be accountable. That means whatever you did, you need to have some courage to accept that one, because sometimes you may give the you may there sometimes you may mistakenly give the medications wrong. So if the sense and if the patients develop any problems, then at the time you need to develop a courage to accept, yes, I am the one who provided the medications, right? You can't ask any other persons, or you can't blame, or you can't put all that blame on the other persons, right? So that courage you need to be developed, be accountable and be courageous. Yes, as I told you that whatever the things you need to be do, you need to have a courage to accept. Courage means you need to have some confidence, right? You need to you need to come forward. That is a courageousness we are telling. If you have any because you are having knowledge, because you are having a proper education and skills, so you are having knowledge, you can't doubt on yourself, right? If they provide any work to you, you need to be accept that, and you need to come forward to do those activities. So if you are not doing those things, and if you are backwarding in that means that you are not acquired a proper knowledge, you are having doubt on yourself, right? So as a healthcare professionals, you can't be like that. You need to be very, very courage, always come forwarding and doing all the things. And if there is any problems, you need to have some critical thinking and find out the solutions immediately, how to resolve that. So that is, we are telling courage, not to be a lazy and a backwarding person, right? So these are the values of person-centered care. Then we'll see the person-centered outcomes. What are the outcomes or the uh, achievements? So person-centered outcomes, there are five mainly: individuality, choice, privacy, independence, and the inclusions. So individuality, again and again, the similar thinking. The person, everyone is different, are respected and recognized. Yes, individuality means the uniqueness. Each and every individual are unique, right? Not all the person are having the similar, uh, not all of them are having similarities. Mostly we are very, very unique. And choice, yes, we already studied regarding the informed choice and the informed capacity. Informed choice means each and every client, they needs to be informed. What are, if when we talk about the treatment method, so you need to inform and you need to give a detailed informations. What are the possible uh, treatment options are available, and how they can access for, if there is a need, how they can access for the social services, what are the welfare services are available. So those things you need to tell in detail. So when telling means, if you are going to tell about one treatment measures, then you need to tell all the things. Okay, so like what are the benefits and what are the disadvantages, and if you take this treatment, how long you will take for the healing. So all, each and every perspectives you need to inform to the person. Then you can suggest the things which is good to the patient body, but you can't compel them. Then after all the discussions and all the clarifications, the client may have a detailed clarification, then they may have the rights to choose what is good. If their choice is an acceptable one, yes, as a healthcare professionals, you need to accept and you need to move further. So in that manner, you can't deny their choice, right? You can't tell, no, no, I am interested to provide this care, so you need to only follow this care. Likewise, you can't tell, you can't deny the patient's choice, right? So that is one outcome: choice. The right of individuals to make informed choices and take responsibility for those choices and related risk. is supported. Yes. So another important one is the clients, they need to be know that they are responsible persons whatever the uh, choice they are making. But the thing is you can't scare the people, like how. So that means you are suggesting one treatment options, but the particular client, she is denying and she chose another treatment options, right? So in that situation you need to respect her choice, and you need to support, and you need to inform to the client that okay, so you make these decisions on your willingness. I accept you, and do throughout this treatment options, I will support you. And if any inquiries, if any problems or if any issues happens, I'm here to support you. So don't worry. So like those are the comforting words you need to tell to the persons. But if you tell like this, like okay, you selected this treatment options, if anything happens to you, you are the responsible one, okay, don't ask from me. So it is not the actual way, because if you say like this, then the person starts to scared, right? So she or he may thinks that this person won't support me, okay, then I can't make my own choices, I needs to go what about what I needs to go with their decisions only. So the persons won't refuse the treatment options if you start to use those words, right? Although they are selecting their treatment options, and if anything happens, you need to confirm that we are here. I am here to support you. Okay, so you can make any decisions without any fear. So you need to provide those kind of support to the particular client. And when we talk about the privacy, yes, so you need to maintain the confidentiality is important. And most in some situations we can't maintain the confidentiality because we are getting those private informations for our treatment purpose as well, right? So in that manner you can inform to the a particular individual that we received all the informations from you because of your care profession, and those informations will be shared only with a confidential manner with a small group of people who are going to work in order to improve your care. So those instructions and the informations you need to give to your client, and after that you need to share the informations only the people who are involving in the care management only. Okay, so other than that, you can share all the informations to all the other peoples and with the patients, and you can make the person's life to be in a job, right? So privacy means that manner. So that is a information privacy, information confidentiality. And also when you are going to provide any care to the patients, and like if you are going to talk with them, so it's better. So normally when we are talking with the client, we are focusing, or we are instructing to use a separate room. Separate room means it is not that much a confined room. So it's a kind of quiet and calm environment where the assessor and the care, the information provider could be there. And if need, you can involve one or two family members. So it is better because the person also may have some free, they may also feel free, there is no any restrictions, then they can express their verbal things as much as possible, right? Because if you start to gather the informations within the ward setup, so there are a lot of patients on the both side, she or he may have other care receivers. So sometimes they may not willing to expose all the informations about themselves, right? So in that situations, you can take a particular care receiver to a private room, and you can have all the proper safety precautions for yourself and for the person purpose. And then you can make a assessment. You can continue assessment process. That is also a kind of privacy. So information and activities are kept confidential. Independence again, yes. So you need to make your client to be an independent one. Once your care is going to complete, your care needs to make the client to be an independent one. Individuals are empowered to do activities for themselves and their dignity be treated in a respectful way. Then when we talk about the inclusion, yes, people are supported to be participated in all aspects of community that they choose and viewed as valued and equal citizen. Yes, although they are coming from various ethnic groups, you can't treat them according to their ethnical differences, right? So you need to be treated and you need to be included in a care as a same. Then only they will think that yes, okay, they are treating me as a whole individual. So you can treat them as a citizens, right? As a Sri Lankan, right? So there is no any Sinhalese, Muslims, or Tamils or any other people. So you can treat, yes, all of them are a Sri Lankan citizens. Likewise, you need to include them, whatever the care professions you are doing. So these are the the outcomes of the person-centered approach, right? So are you all clear up to now, or do you have any questions?
Clear, madam.
Then we'll move to the person-centered assessment. So far we discussed about the person-centered approach. So person-centered approach means the ways of working, right? So how you are going to work. So now we will see what this person-centered assessment means. So person-centered gathering information. So what that means. An assessment that identifies services based on an individual with disabilities, priorities, interest, and unique situation or needs, right? So assessment, person-centered assessment means you are going to gather the informations from one person based on their individual perspectives. Okay. So individual perspectives means so it could be any person, not only a disabilities, but it could be any persons who are needing a care. So it could be any needy person. So you are gathering informations from a needy person. So that needy persons could be uh, disability persons, or it could be different individuals priorities and depending on their situation. So it could become like that. So you are going to take that information. Focus on individual strength and ability. So the major importance of taking this person-centered assessment is, so we can identify the individual strength and abilities. Yes, it is important. So apart from identifying the patient, clients, family and other backgrounds, you need to identify their strength and abilities. Then only you can develop your care plan according to that. What strength they are having. Are they sensitive to the minor, are they are very sensitive, or whether they are very rigid person, whether they can adapt to all kind of environment. Those things you need to check. So those are the strength and abilities. Emphasis is given to settings, services, supports, and routine available services. Yes. So in addition to that, you're emphasizing when you are gathering the informations, you need to give your emphasis to the settings. Settings means the situations, the healthcare settings. So how the patient situation is. What about the family background? How about the family situations? All those things you need to provide the emphasis. And the services, how the services are gained. What are the services the person is accessible now? It can be hospital-based services or any other social welfare services, whether they are accessible and affordable for them. So those things you need to be emphasized. And support and routine available services, and what kind of support they are gaining. When we talk about the family, so what kind of support they are gaining from their family. Like that, you need to make your emphasis when you are doing the person-centered assessment. involves the person-centered planning process and acting so the individual can achieve his or her goals. Yes. So you need to involve a whole person. So during the person-centered assessment, you need to involve the whole person. The person should be involved wholly. Then only the assessment should be an effective one. So this is regarding the person-centered assessment, right? Okay, now we'll see how these person-centered ways of working are supporting the individual to participate in the assessment process. So if you are going to work in a person-centered approach, simply if you are going to work in a partnership with your client, then how it will influence your individual to support your assessment process, right? First, respectfully involving the person in a way that helps practitioner provide care that is concordant with their patient's values, needs and preferences while enabling patients to actively provide input and participate in their healthcare. Yes. So if you work in a person-centered way, that means if you respect your person and if you respond to your person needs according to their value. So if you respect your client means if you respect their culture, their needs, their values, their preferences, and if you start to respect all their needs and what will happens automatically, then the particular client will develop a good impression on you. Moreover, we can say a good, she or he starts to trust you, right? So that quality will be that relationship, the trusty relationship starts to develop. If you start to do these things, when you start to respect at the first moment and when you accept and when you respond to all the patient's needs, then they will think, okay, she is a supportive one. She is a kind of supportive to me and she will take over all my problems and she will provide me a good solutions for my problems, right? So in that manner they start to think. If they start to think, then automatically a good impression and a trusty relationship will be developed on you. After that, whatever the questions you ask, they will start to provide all the informations without any hesitations. And they won't refuse your words as well, right? So they start to involve yourself in their care profession. And sometimes they may ask you to make decisions on behalf of them and they like to get ideas and suggestions from you, and also it's easy for you to convince them, right? So it is a helpful manner. So that is why we are using this person centered approach. So in the person centered approach, actually it will be helpful you to get the maximum informations and maximum criteria from your assessment process, which will be useful for your to achieve your outcome. The next one is clients become more satisfied when they feel that healthcare providers are understanding their needs, actively listening, and clearly providing the information. Yes. So this will also another important one. They may think, yes, you are understanding their needs. You are understanding their situations. Then what they will need, okay, you are actively listening. So you are going to be active listener. So once you to be actively listener and once you provide a crystal clear informations, then they will think, okay, so this person understand my situations and he is willing to hear my problems and issues. Then they will start to provide all the informations, right? Because if you are behaving like a negligible person, then they will think that okay, you won't listen all your problems and sorrows, so they start to hide everything. Only they will provide some overview about themselves. But if they think that you are here to listen and you are an understandable person, then they will think, okay, I got one person who can hear all my problems, and they start to provide all the problems and issues, whatever they're going through and whatever the things they are keeping inside their heart and mind, they will expose you. Effective person-centered communication skills of a care provider makes an individual to be more involved in their care assessment. Yes. So you already studied how to have a good communication skills as a professionals, how you can develop your communication skills. You have a separate modules as a communication in a care professions. I think Miss Ganguly have completed that module. So now you have a good understanding about a professional communication patterns. So how you can how you can interact with your client. So which ways will be helpful for your with your client to make a uh, good impression about yourselves. So how you are, what are the ways and what are the techniques you can use in order to develop a good impression on your client. So those things you studied, right? So it is important. Whatever the relationship we take, communication is an important one. That communication, if the communication is very, very strong, then that relationship won't be destroyed easily, right? Because communication means you are going to share all your thoughts and ideas with words, right? If the words that you are using proper manner only, your ideas will be conveyed to other person. So when it is the same to the therapeutic relationship as well. The words and the nonverbal communications that you are using is going to convey a message to your client. So if they are very accurate and if they are very understandable manner, then the client also will develop some kind of secureness with your words, right? Because normally we are telling words are having more powers than the actions. Even a comforting words, actually each and every person admitted to the hospital, they are needing a comforting words, right? A supportive words. So your words and your behavior, it will make an individual to feel more secure and protective. So if they starts to feel about yourself like that, then they will start to provide all the informations. Because if they feel that you are a protective and a securable person, and also they may develop whatever I tell to that person, you won't you will maintain all in a confidential manner, right? So you need to be have or you need to be develop that skills. So it will be also, if you have an effective communication skills, it will also helpful for you to in a include individual in assessment process. Active listening and proper responding for the cues of a client. Yes, active listening is important one. Active listening means, so when you are communicating or when you are in a when you are interacting with your client, always you make an eye contact with them. So the eye contact will uh, expressing that you are listening to them, right? And also when after finishing the page, the client's all the talking, you can just summarize what the client tells to you. You can just paraphrase it, or you can just summarize it. So why we are telling? Because once you summarize, that means you are like a summarizations you are asking, you are telling like this. So at the end of each uh, talking, once you ask like this, then client will thinks, okay, so she listened all the problems that I told to her, or she listened all the things that I expressed to her or him, right? So then they can, okay, then they will tell, and eventually they will start to tell more and more about themselves, right? If you start to ask questions one by one, then they will start to tell more and more, because that eye contact and the summarizing are important, which will express that you are an attentive listener. Otherwise, if you are not telling and if you are not providing those summarization, then the uh, person, the individual, she or he may not have a clear understanding that whether you listened or not, then they start to hide all the things from you. So active listening and the proper responding. Proper responding means sometimes when the client is telling in between their conversations, she may ask like, right, no? So am I, so sometimes they may ask questions from you as well. Sometimes they may ask, am I boring? Or can you understand my situations? Are you feeling the same? So likewise, they may ask some questions. So you need to be provide some response. Yes, I am listening. Yes, I can understand your situations. Likewise, you need to provide some words to them. Then only it will be helpful for your assessment process. By minimizing degrading the issues raised by the client. Yes. So, with the person-centered approach, you need to find out the solutions as much as possible to minimize the issues raised by the clients. So why it is important in the assessment process? So it is telling that you are responding to the patient needs. So minimizing the issues means the patient is now suffering from one problem. So you address those problems and you find out the solutions as soon as possible, and you are minimizing the patients to overcome, and you are start to minimize the problems what the person is facing. Then again, it's also going to develop a kind of support and protective nature among about yourself from the person. Then what will happen? Eventually, she or he starts to develop a good relationship and rapport with you, and it is going to influence on your assessment process. And again, be a good observer of your client. Yes, sometimes the person, they may not tells all the things verbally. Okay, their actions, right? Their actions and their attitudes and their expressions will tell lot and lot of informations. Once you observe all the things only, you can gain all the informations, and it will be helpful for your assessment process. So this is regarding how and the person-centered approach is going to work to on the individuals when we are talking about the assessment process. That means how it is going to support for the individual to involve in the assessment process. So that's all about today's sessions. It's a very a, a small topic, because you already know more about this person-centered approach because we studied in detail about this person-centered or the client-centered approach. So here I want to just recall all the things, and I want to mainly emphasize here because you need to know the how it's the this person-centered approach is going to influence on your assessment process, how it's going to involve the individuals, by involving how it's going to support you in the assessment process. That is, I need to emphasize here. So that is about the today's session. If you have any doubts, or if you need to put your ideas or suggestions, you can tell it now, so we can have a discussion. Any questions?
No, miss.
Okay. What about the others? Do you need any more clarifications or any doubts needs to clarify? If you are not having any doubts, we can wind up the session. So, do you have any doubts?
No, ma'am. We don't have any doubts.
Okay.
Thank you.
Okay. So, if you develop any doubts afterwards, also you can go through the recordings and lecture note and feel free to contact me if you develop any doubts. So, see you all in the next weekend. Have a nice Sunday. Bye.
Bye, ma'am. Thank you, miss.